A 35-year-old male presents to the emergency department after sustaining a head injury during a fall while rock climbing. He was wearing a helmet at the time of the accident but lost consciousness briefly. On arrival, he is alert and oriented but complains of a severe headache and nausea. Physical examination reveals a large hematoma over the right temporal area with associated swelling. His Glasgow Coma Scale, GCS, score is 14. Neurological examination is notable for right-sided weakness and dilated right pupil. CT scan of the head shows a biconvex-shaped hyperdensity over the right temporal region with midline shift. Based on the clinical presentation and imaging findings, what is the most likely diagnosis? A. Subdural hematoma. B. Epidural hematoma. C. Intracerebral hemorrhage. D. Subarachnoid hemorrhage. Based on the clinical presentation and imaging findings described in the vignette, the most likely diagnosis is choice B. Epidural hematomas typically occurs due to a tear in the middle meningeal artery following blunt trauma to the head, often from a skull fracture. The classic presentation includes a lucid interval followed by a deterioration of consciousness. These types of hematomas do not cross suture lines. In this case, the patient lost consciousness briefly after the injury, but then regained alertness, which is consistent with the lucid interval. However, he subsequently developed symptoms such as severe headache, nausea, right-sided weakness, and a dilated right pupil, indicating neurological deterioration. The physical examination findings of a large hematoma over the right temporal area with associated swelling, along with imaging findings of a biconvex-shaped hyperdensity over the right temporal region on CT scan, further support the diagnosis of epidural hematoma. The biconvex shape is characteristic of epidural hematomas and results from blood accumulating between the dura mater and the inner surface of the skull, causing the hematoma to conform to the shape of the skull. If you found this video helpful, don't forget to subscribe and comment below on what you want to see next.